We have a 35-year-old patient coming in after a long flight. He's complaining of leg swelling and pains for about 3 days, and he's also having shortness of breath and pre-syncope. His blood pressure is low, he's tachycardic, respiratory rate at 30, and he has an elevated JVP. Okay, so this is the first view, which is the parasternal long axis view. We see the left ventricle, the left atrium, and the ascending aorta. We can see some part of the right ventricle, which is the RVOT. You can appreciate that the ventricle is pumping really well. All right, let's go to the short axis view. On short axis view, you can recognize that this is the left ventricle, this is the right ventricle. And it's very obvious in this image that the right ventricle is larger than the left ventricle. That's the first clue. The RV should never be larger than the LV. The second clue, look at the septum, how the septum is bouncing towards the left ventricle. This is another clue that the right ventricle pressure is very high, to the fact that it's pushing the septum towards the left side. In normal patients, this should never happen because the left ventricle pressure is very high. Okay, let's go to the apical four-chamber view, and we will need to adjust the depth in this one. All right. And this is the left ventricle, this left atrium, right ventricle, and right atrium. If you look at this area where the RV ends, it seems that the RV is trying its best to contract, and that's because there's something impeding it from contracting very well. Let's go to the subcostal view. Okay. And in the subcostal view, we can see also that the RV is trying its best. It's trying to pump all that blood against high pressure. This is the left ventricle, right atrium. All right, let's get the IVC. All right, let's get it all in one image. All right, and you can recognize in this area that there's a vessel going into the right atrium, and this vessel is not collapsing at all, and it's not having any variation with breathing. This tells us that the pressure in the right atrium and right ventricle is very high. Show us the descending aorta. Okay, tilting. This is the descending aorta. So all in all, if we want to sum this up, this is the patient who came in after a long flight, has been having leg swelling, shortness of breath, hypotension, tachycardia, and with all the signs that we see on echo, RV strain, we have high pressure in the right atrium, right ventricle, IVC dilated, and the septum is bouncing towards the left. This is most likely a DVT that led to a pulmonary embolus. We cannot see the embolus on the echo, but we can see signs of increased pressure.